The New Brunswick Nurses Union felt it was very important to embark on this newest campaign with our members, talking about picking up the pieces of our healthcare system. We know as New Brunswickers and as nurses working in the system that our system is broken. In many cases, it seems to be shattered in many pieces right now. So the theme for our annual meeting and our ad campaign is about picking up the pieces, and that nurses are forefront and willing to do that with employers and government to ensure that we have a healthcare system that's put back together properly.
We have these shortage of nurses in New Brunswick, and we have read the news that so many, I think around more than 100 nurses, they quit, I think last year or over the year. What do you think the provincial government or the association should do, to tackle this issue?
So we've been saying for many years that if a strategy to retain and recruit nurses was put in place meaningfully, that we'd be where we are today. We know with our demographics and our age and whatnot, and actually the acuity of the patients that are entering the healthcare system has been on the increase as well, which then in turn creates greater stressors on the shoulders of nurses in the system. So there needs to be dedicated and very robust plans about trying to retain the staff that we currently have in our system and the experience, as well as recruitment. Recruiting the young people or anybody that's interested in entering the healthcare field, it needs to participate in, really showing them that healthcare is a very viable, rewarding career. And without actually putting more into the system, it's only going to continue to get worse. So I think it is about the concentrated efforts of government and employers to really sit down with us and other stakeholders to come up with meaningful ways and ideas to ensure that we retain and recruit in a great way here in New Brunswick.
Back to the campaign, could you tell us more about why you started this campaign, or is it the first time, just for laymen to understand about the picking up the pieces campaign?
So we do campaigns on an annual basis, pretty much. Our most recent one was Who Needs a Registered Nurse? That was prior to us representing licensed practical nurses. And so it is about, it's timely right now in the fact that we're hearing almost on a daily basis in mainstream media, this ER is closed, or this service is closed, or, don't come unless you're dire because of staffing shortages. And so as professional nurses who show up every day to hold our system together, we recognize it's broken, it's fractured, it's in pieces. We're in the middle of probably one of the worst crises in recent history. And what we're saying is we need the help of governments and employers to sit down with us, to listen to some of our ideas, to work with us to look at sustainable solutions so that healthcare will be there for New Brunswickers in the future. So we utilized all New Brunswick nurses within our campaign who tell their stories. Right? Nurses have gone into the profession because they care and they want to make a difference in someone's life, but they're struggling. They're struggling every day to meet their moral and ethical obligations as licensed practical nurses, as registered nurses and nurse practitioners. And that's becoming increasingly hard. So to hear their stories, the very people who continue to show up every day to do their best under the situations that they're in, I think is very powerful. And I think, and I hope, that New Brunswickers can relate to these stories and really get behind the nurses to say, we want better healthcare in our province.
Right. I think you already know the government announced a new initiative. They want to hire nurses or healthcare professionals from abroad. Do you see this as a move to, trying to tackle the issue, or they're just we don't have enough nurses, here, so have to like hire from abroad? Like how do you see this new initiative?
I see the hiring of internationally educated nurses as one part of the solution. I think, we've heard over the last number of years that, oh, we don't have enough people here in New Brunswick to meet the demand, the supply's not there. That's why we're looking elsewhere. I think every jurisdiction in Canada is looking at internationally educated nurses, because this is not unique to New Brunswick.
Yeah.
Canada as a country, just like many other countries, are faced with a human resource shortage in healthcare. So although I think it's part of the solution, I don't think it's the only solution to our problem. We need to really reach out to the young generation, get into junior high schools, high schools, talking to them about the wonderful career that nursing and healthcare has to offer. We need to then make space for them and make it affordable, make it accessible. We need to have the universities on board with us and the community colleges. Do we have enough seats to actually facilitate those that want to go into healthcare? And is it accessible and affordable? Not everybody has the ways and means to get there, even though they want to be a nurse someday. So I think we really have to look at all the barriers that are in place and start knocking some of those down here in our province.
So you said it's not affordable right now for like, say like for someone coming from like low income, like is it like too costly for them, to become a nurse, or what should the government do to make it like more affordable for them?
Well, we might have to look at, reducing tuition rates. We know that if you are wanting to become a registered nurse, it's a 4-year baccalaureate program, going to university, potentially uprooting. If you live in rural New Brunswick, you may have to leave your home to come into urban centers. You're looking at housing and travel and your tuition, your books, and everything else. At the end of 4 years, you'll be leaving the nursing faculty with a huge student debt, right? So why are we not making that a little bit more affordable and attracting, those that potentially may feel that it's outside of their financial abilities to do that? Our community colleges as well. We know that some of our community colleges, especially the private ones, they are quite expensive to offer this course for licensed practical nurses. Are there ways and means to do that? Now, I know post-education training and labor are looking at different ways to ensure we can, reach out to the rural centers in New Brunswick to try and get as many people into those programs. But I think we can't stop there, right? We can't just say that's enough. We need to continue to look at what are some of those barriers. We also know part of the barriers is the seats availability, right? In universities, we've heard, particularly at the University of New Brunswick, that there is an exhaustive wait list to get into the faculty of nursing. Why is that? We need to look at, do they have enough supports in place, professors, clinical space, laboratory space available to support those students that want to become registered nurses.
One thing we never talk about is like how nurses went through the pandemic and post-pandemic, about their like mental health, and I'm pretty sure like you have those cases within your organization. Like if you can say something like how nurses have dealt with the pandemic and post-pandemic.
So we're still in the pandemic. We've not declared pandemic yet. I've often heard that lately, that everybody says, well, COVID's over. It's not. We're still in a pandemic. The World Health Organization has not lifted that declaration. What I can tell you is even pre-pandemic, nurses were feeling stressed because they were already in a shortage. So then when we added the declaration back in March of 2020, it was a greater stress on them because it was the unknown very early on. And then it was, working with full PPE and trying to get access to PPE, and then taking care of patients who were much sicker, seeing them in our hospital system. The New Brunswick Nurses Union actually did 2 surveys of our membership, one for registered nurses and nurse practitioners and one for licensed practical nurses, really checking on them, their mental health, their well-being, how they're feeling, And, you know, alarmingly, not surprisingly, but alarmingly, the majority of nurses in this province feel overwhelmed, feel on the verge of burnout, feel stressed out, feel like they have an obligation and they feel like they have to continue to show up to take care of New Brunswickers because that's what nurses do, but it's almost at their own detriment. So we've released both of these reports, and we're saying that more mental health supports need to be put in place, especially for those that have been providing healthcare throughout this pandemic.
Right. So last question, what should the federal and the provincial governments should do, to fix this issue of like shortage of nurses, making it more affordable for them to study? Like, what do you think the government should do?
So most recently, the Canadian Federation of Nurses Union had the opportunity to meet with our Prime Minister, Justin Trudeau, the Federal Health Minister, Jean-Yves Duclos, and the Minister for Seniors, Camilla Cara, to talk about the national nursing workforce initiatives, the fact that we do need a forum here, that every jurisdiction is competing against the other, when in all reality, we need to be thinking about Canada as a whole. So the federal government needs to be investing more monies, but monies that are, I won't say strings attached, but have accountability. And they're dedicated for healthcare initiatives and supports for those that are already in the system. In the province, in our provincial government, what we need to be doing is sitting down more frequently. It's not about creating a health plan and then running off to try to implement all of those pillars, but to have those frequent check-ins with the stakeholders to find out, have things changed? Because as we know, healthcare is very fluid. So I think it's about listening and having open discussion with employers, with government, with long-term care providers to say, what is it that we need to be doing to ensure the safety of healthcare delivery, but also supporting those that are in the healthcare sector. We know right now that every facility in this province is struggling. If they're struggling, we need to say, are we delivering services appropriately? And if we only have so many healthcare providers at the moment, what can we do to ensure we have good healthcare with the appropriate supports in place for those that are delivering it?